Ty Gibson, Pine Island High School. The entire world was affected by COVID. Severe COVID cases, job loss, high employment rates, and millions of deaths. On November 1st, 2021 is when my uncle died from COVID-19, just one of the millions of other people. It was my sophomore year of high school when things were just getting started and I was starting to become a young man. In school, I would struggle a lot and not be able to focus on things just because I lost one of my closest family members to me. He was still young, he was in his mid-40s, he had a beautiful wife and kids, 2 daughters and a son who was just born. He was no ordinary uncle to me. He taught me the basics of life and how to live life with joy, but with discipline. 2 weeks before his death, he was sent to the hospital due to COVID-19. He was unable to breathe by himself and he was in so much pain, it was unbearable. On November 1st, 2021, is when my aunt decided to pull the plug and let the pain go away, but us as a family, that's when it just started. Earlier that evening, my dad came home, told me the news. We stood there hugging and crying, didn't know what to do. The grief from his death was unbearable, but we had to keep going, and we did. When vaccines first came out, we were hesitant on getting one. We waited till it was safe, and everyone has a choice. Again, us as a family chose to get vaccinated. As soon as everyone in our family got vaccinated for COVID-19, except for my uncle. He stated that he was strong for it, he can handle it, and it was nothing to him. Everyone should get vaccinated for COVID-19. It helps with protection, helps with hope, and they give us lots of protection. Vaccines, over time, more and more people have gotten vaccine with a step in the right direction. My experience with COVID is not just an individual struggle, it's something that affects us all. In fact, we all struggle from COVID, either financially, politically, physically, or mentally, and we're still learning from it. In the early months of the pandemic, we were forced to go to quarantine and mask mandates. According to the World Health Organization, a United Nations agency, in an article titled "WHO Coronavirus Dashboard," last updated on August 16, 2023, there have been 769,806,139 confirmed cases. This just shows how much COVID has affected us in the world, but it's also the individuals of people in the world in their homes, like 15-year-old me, isolated in my home, not being able to focus on things, sitting in front of a screen, doing schoolwork, not being able to socialize and explore in the world. When I was a 15-year-old boy, it was hard for me to adapt to these new changes and isolate in my home. Stated by Narita Panchavel, a senior policy analyst, in an article titled "The Implications of COVID-19 Mental Health and Substance Use," published on the KFF website on Monday, March 20th, 2023, the pandemic has affected the public's mental health and well-being in a variety of ways, including through isolation and loneliness. We were all isolated in homes. We would not be able to explore the world. We would not be able to meet new people. But it wasn't just that affected us. It was also the severe COVID cases. As referenced by Kathy Cattell, a senior clinical writer at Yale Medicine, in an article titled "What Happens When You Still Have Long COVID Symptoms" on Yale Medicine website, published on June 7th, 2023, the symptoms such as chronic pain, brain fog, shortness of breath, and intense fatigue. These are just some of the long-term effects COVID can have on you and your family, and some don't even know it. COVID is still affecting us to this day, and we don't even know it. According to the CDC, the nation's leading science-based organization that protects public health, in an article titled "Risk Assessment Summary for SARS-CoV-2 Sublineage BA.2.86" on CDC website, published on August 23, 2023, CDC has detected a new SARS-CoV-2 variant labeled BA.2.86. We may not know how dangerous the new variant is, but we do know how not to spread it. Wash your hands, practice good cleaning habits. It's clear we have to take action now. But what can we do about this? We can take action now by getting vaccinated for COVID-19 at your local clinic or pharmacy. You can visit or call your local Hy-Vee, Walgreens, or clinic right now and schedule an appointment right now. It's clear we have to take action now. Vaccines have given us a hope and an aid to fight against COVID-19. They have given us protection for ourselves, our loved ones, and our communities. The progress we have made with COVID-19 is great, but with new variants coming out, we may not know how safe we are yet. Let us take a step forward to take action now before it's too late. Thank you.